The two most important suggestions that psychiatrists and mental health professionals offer to people who are trying to recover from a mental illness or a dual diagnosis is that we take our medications the way they're prescribed and we don't use any non-prescribed drugs or alcohol. And these are very important for anyone with a mental illness or a dual diagnosis. Co-occurring is being approached as the expectation and not the exception, that most people with mental illness also have issues with addictions, and most people with addictions have issues with mental illness. The psychiatric medications, clean time and sobriety, are essential if we want to pursue accomplishing our realistic potential. A lot of Christian fundamentalists or people in 12-step programs, they discourage medical compliance, saying that it's necessary that we get off of our medications and not take them, but they're not educated in psychiatry or mental health. They may have good intentions and not have any motives, but when they don't know anything about psychiatric illnesses or the medications, it can be very damaging and detrimental to people if they listen to them. I personally will stay on my medications until me and my doctor or psychiatrist or practitioner agree that I no longer need them and I can be taken off of them in a gradual way, and monitored by the people in the medical profession. I'm reluctant to stop taking them against medical advice. It could ruin the rest of my life if I did that. I believe in God. I believe that Jesus Christ is the ultimate healer. And I really appreciate and need all the prayers and all the support that I can get. And if people think highly enough of me to pray for me, I really appreciate that and thank them for it from the bottom of my heart. And if a Christian wanted to put his hands on my head and say a prayer over me, I would be fine with that, but I still need my psychotropic medications and the treatment and the therapy and then voc rehab if I want to live and function somewhat normally in this society, in this community. It's just very important. People in 12-step programs, they may believe that that just stopping the abuse of drugs and alcohol, that may be enough. But with me, the bottom line is people with psychiatric illnesses and dual diagnosis, the two most important suggestions that are offered to us by psychiatrists and professionals and people in the field are that we take our medications the way they're prescribed and we don't use any non-prescribed drugs or alcohol. In the past, they were more open to tobacco. Nowadays, that's changing, and they're becoming more discouraging of tobacco and even not allowing it in treatment facilities and mental health centers. You know, I believe in God. I believe He's a loving God. I believe in Jesus Christ. I believe that Jesus Christ is the ultimate healer. But, you know, for my own choice is that I will stay on my medications and take them the way they're prescribed, and be open and honest with my providers. I think this is very important. Like people in churches or in 12-step programs, they may mean well, and they may have good intentions, but they're just not qualified to give medical advice to people with physical or psychiatric illnesses. And you know, I'm probably going to need my medications for the rest of my life. Somebody with schizophrenia, there's no known cure for my illness. It's unfathomable to me that I'm okay with this, because I do have a lot of people who care about me, and I have some significant freedom, and I'm able to live at home in this community and be a part of it. And I really cannot thank God enough for this. You know, and as I continue down the journey of the road to recovery, I just hope that I'll be able to help myself and accomplish what I can and be helpful to others.